Welcome to the Endocrine Matters podcast. This podcast episode is sponsored by Complete Medicine and Hey Healthy. Welcome back to Endocrine Matters, the show where we tell the truth about hormonal health, call out the broken systems that keep women from getting the care they deserve, and build a new model of medicine rooted in evidence, empowerment, and human connection. I'm your host, Dr. Arti Thangudu, endocrinologist, disruptor, and believer that women's health shouldn't be an afterthought in any exam room, policy discussion, or scientific study. Today, we're diving into a topic that should be at the forefront of every conversation about women's longevity, Alzheimer's prevention. And I'm joined by a woman who has truly reshaped how we think about protecting the female brain. Barbie Boules, RDN, also known as the Cognition Dietitian, is a registered dietitian, speaker, and writer with more than 20 years of experience and over 1,800 clients served. She blends rigorous evidence-based science with deeply practical strategies that help women actually change their lives, not just their intentions. Barbie has developed corporate wellness programs for more than 200 organizations worldwide, mentors future dietitians as a preceptor for Loyola University Chicago, and has built a powerful platform through her best-selling Substack, The Synapse, and her influential Instagram community. Her purpose is bold and deeply aligned with what we stand for on this show: empowering women to preserve and protect their brain health through nutrition, movement, sleep, stress mastery, meaningful connection, and living a purpose-driven life. Today, we're going to talk about what women aren't being told about Alzheimer's, why the standard care model is failing us, and what women can start doing right now, long before symptoms ever rise, to protect the most vital organ we have. This is a conversation every woman deserves. Let's get into it. Barbie, so happy to meet you. And I was on your show a little while ago and we got to chat there, and I'm excited to continue that conversation and learn more about you this time.
Oh, thank you so much. It's so great to be here. I deeply appreciate the invitation and your work. I'm a huge fan, so this means a great deal to me. Thank you.
Right back at you. I'm a huge fan of yours as well. And one day we're going to meet in person because I know we have a friend in common who I love, and I will visit soon because I know she's local to you. So,
Yes.
So excited to have you here. So first, I just wanted listeners who may not know you, to learn a little bit about you, your story, kind of what brought you here, what motivated you, what inspires you.
Yeah, thank you. So I've been a dietitian for almost 25 years, and always with a focus on women's health, and always in private practice. So that was my kind of jam right from the get-go. One of the things I noticed in school is that there wasn't much distinction between men and women. And in many ways that's appropriate. But other than lactation and pregnancy, we just didn't learn a lot about, and I don't think menopause was ever raised. So I noticed that, and I found that really interesting. So I wanted to do whatever I could to find out more about the distinction between men and women in terms of nutrition and lifestyle, as in terms of aging well. That was always kind of my focus. And then as I've gotten older and evolved, and my interests have evolved, and my client population evolved into our 40s, 50s, and 60s, I started to notice all of these changes that seem to happen out of nowhere, and of course they don't happen out of nowhere, right? But it seems like they do, like higher blood pressure, elevated LDL cholesterol, changes with glucose regulation. Certainly weight gain is probably one of the first things women notice. And if I didn't do this for a living, I would not have understood why that was happening. And yet I would see that all the time. Now that we have so much more information, and the menopause transition is so highlighted and discussed so much more frequently, I think women are far better educated. Like a layperson is far better educated now in her 40s and 50s than I was even as a dietitian 20 years ago. So that really interested me. And as I started to understand more about metabolic health, I realized that that is really the foundation upon which the health of our brain rests. So I started getting really interested in the brain. Then when I found out that nearly 2/3 of Alzheimer's patients are female, that really fascinated me. So it was just sort of this kind of domino effect of bringing me from one thing to another. And after about 5 years of researching brain health and Alzheimer's risk in women, the passion became personal when my mother was diagnosed a few years ago with Alzheimer's disease. And she lived with me for 4 years until this summer, when we moved her into memory care. So I see this disease on the page and in lectures, and I also see this disease up close and personal for 4 years now. So it is absolutely my mission in life, my life's work. I will never stop doing this to help reduce Alzheimer's risk disease in women.
That is a just powerful journey, and it's crazy how life kind of serves us in the most confusing of ways,
Yeah.
but sometimes gives us clarity on what our purpose is.
Yeah.
And I think if we can really use hard things to fuel us and to help us help others,
Yeah.
there's just so much power behind that. And so I'm thrilled that on top of being a caregiver for your mom, who I'm sure knows she's so lucky to have you, that you're sharing your wealth of like credible expertise as well as experience with our community.
Thank you. Again, I really appreciate being here. And I didn't think I could become more passionate about this topic of women's brain health from a nutrition and lifestyle perspective, because obviously I'm not a physician. But of course I did. It's kind of all I think about, with my mother's diagnosis. And when that happens, it happens, all of us will be touched by this disease in one way or another, whether it's, a direct loved one. We're acting as caregivers. It's us, it's a friend. It's, this disease is becoming the numbers are already just far bigger than they should be. And they're expected to double in the next, couple decades. So we need to act now because all we have at the moment is prevention.
Yeah. Yeah. And prevention is so important and so foregone by the traditional healthcare system that that it is important for us to talk about.
Yeah.
And I love how you talk about how midlife is kind of this window of opportunity in women's health, because I feel that way too. And I also even with prediabetes, a lot of people get, I see a lot of people with diabetes, prediabetes, and metabolic disease. And people are diagnosed with prediabetes and they're kind of given two sides of the story. Either they're told, oh, it's just a touch of sugar, you don't have to do anything right now, which I think is terrible advice. And also, some people think it's like a death sentence. Like they think that there's nothing that they can do about it and that they're going to have diabetes and they're going to have complications from diabetes. I think both of those approaches are completely wrong. I think that prediabetes, while I don't even really like that term, I think that we could give it a more accurate term. But I think it's a huge window of opportunity too. And I think midlife and a diagnosis of prediabetes often overlap. So I would love to kind of hear more about what you mean by that. And what women might be able to do.
Yeah, so few reasons that I have that perspective. First and foremost, what we now know is that the changes that can ultimately lead to dementia, all forms of dementia, actually begin in midlife, particularly Alzheimer's disease. So, many people still believe that this is a disease of older age, but it's not. It's actually, as the great Dr. Lisa Mosconi has said many times, and I will quote her kind of probably poorly, that Alzheimer's disease is actually a disease of midlife that doesn't start showing symptoms until later age. And so clearly there are changes that are happening during this phase that we could maybe head off at the pass if we were doing certain things to take care of our health. Secondly, we now know also because of research in the last 5-10 years that what our metabolic health looks like. So our blood pressure, our LDL cholesterol or ApoB, our blood sugar, and our body composition, or whether or not we're carrying excess visceral fat. Midlife is when that really starts to matter. It doesn't ever not matter, but this is sort of the inflection point where we really want to get after taking care of these numbers, because with all of those things that I just mentioned, so insulin resistance, high blood pressure, elevated LDL cholesterol, and carrying excess visceral fat, the cumulative time that you're exposed, that your body is exposed to these things matters. So it's wonderful if, let's say, you've had elevated LDL cholesterol for 10 years and your doctor didn't really say much about it, which is super common. I'm sure you see that too, probably with HbA1c also. It's kind of ignored until it gets to the point where we're kind of in a crisis. But so you get on statins, or you get on metformin, or you get on a GLP-1, and now your numbers normalized and you're healthier. That's fantastic. However, the 10 years that you spent in, a state of sort of dysregulation with these things matters. It has probably done a little bit of damage. Nothing to freak out about. Just get after it now, because the longer we let that go on, the more at risk we become. Also, and this is just sort of not a sciencey answer at all, but I think that midlife is a window of opportunity, particularly for women, because many of us, certainly not all of us, and there is a lot of stress at this time in our lives for sure, but a lot of us are sort of coming into our own and figuring out what we want to be doing and finding a purpose or reconnecting with a purpose that we may have had in what feels like a past life, but we've been ignoring for decades. It's really a time to start turning all that energy we've spent decades putting out into the world and kind of refocusing it on ourselves. So there's a physiological reason and a scientific reason, but there's also this sort of more, human or spiritual reason that it's really this really awesome window of opportunity.
Yeah, I think that midlife, once you are starting kind of in your late 30s, 40s, I think that, you spend your early life just kind of figuring it out, getting through school, doing all that stuff. And then for a lot of women, your 30s, late 20s, 30s, is just dedicated to very little children. And that is all consuming.
Mm-hmm.
And not that older kids, mine are 9 and 7 now, not that older kids aren't all consuming, but it's just not the same.
No.
You just are so in it. Not to say that everybody has kids at that time. I know there's people who have kids at all different ages, but generally, and I think that there's this time in our late 30s as the kids become slightly more independent, perhaps early 40s, mid 40s, where you all of a sudden have this almost choice
Mm-hmm.
of, do I go down the path of continuing to serve everybody else, or am I confident in myself enough that I know I can serve others, but I also know that I deserve some of my own time, and not more than that, I need it.
Yeah.
And so does everybody else. It's good when you are filling your own cup.
Mm-hmm.
Everybody benefits from that. And I think I love that kind of more philosophical viewpoint. The other thing that this made me think of was with diabetes, we have data to show imprinting. So
Mm-hmm.
if people are treated very well, or they have very good diabetes control close to diagnosis, even years later, if their blood sugar gets less controlled or their A1C goes up, they still have lower risk of complications than those who have been poorly controlled the whole time.
Mm-hmm. Mm-hmm.
And so, I don't know the data on all other biomarkers,
Mm-hmm.
but perhaps that is true for everything else, because aggressive early intervention usually helps most things.
Right.
Whether we're talking about diabetes or cancer or really anything with health.
Mm-hmm.
So I do think that that's a really interesting thing that we should be thinking about, because our current healthcare system is very reactive.
Yeah.
Like, wait until the person has a heart attack and their A1C is 16, and that's when they really know that this is a problem. That's when we get really aggressive, after they've been on ECMO and like all this stuff. Whereas specialties like ours, like registered dietitians, endocrinologists, things like that, they're just not rewarded by this medical system, and they're not given the time that they truly need. So that's really, really interesting. So when you talked about some labs like ApoB, and there are some like genetic markers for Alzheimer's. I would love for you to kind of talk about those, because I think there's a lot of people talking about those, and some people are giving people confusing information. So I'd love to kind of have you clarify what those labs mean when it comes to dementia, and just walk us through that.
Yeah, absolutely. Just to go back to what you were saying for just a second, one of the things that's really important to me is that women in midlife feel empowered and not fearful. I think that little mindset shift of like, there's a lot I can do, and this is a really interesting time, and maybe I finally have the freedom to do it. That's a really important piece of prevention. So in terms of blood work, as a dietitian, I can't order blood work, but I always make the suggestion. And sometimes I'm working directly with someone's doctor. And what I like to see, because we know that they influence our risk of dementia, is primarily LDL, or a lipid panel. So LDL cholesterol, HDL cholesterol, and triglycerides. I like to tack the ApoB on there, ApoB being a better representation because it tells us about all of the atherogenic particles in the blood, not just LDL-C. Blood pressure, obviously, super important. And we really want to keep it more around like anywhere between 60 over 90 to 115 over 75, as opposed to kind of the 120 to 130 and 80 to 90 that some people find acceptable. Just keeping it, in that nice low range, super important for protecting your vascular health, and the vasculature of the blood-brain barrier. And HbA1c, clearly insulin resistance is strongly linked to dementia, vascular and Alzheimer's. And then there are some that, may not be super standard, but I like to see, like HSCRP, so high sensitivity C-reactive protein, homocysteine. I like to see people's B12, vitamin D, folate, and iron. Those are really the important ones. And of course, thyroid, but that thyroid is not my specialty, but I just want to make sure, because that can, be changing in a woman's midlife. I would always refer to an endocrinologist if something wonky is happening there, but I just want for the woman to have that information. But that's what I would say, because now, type 2 diabetes, or I should say diabetes, and elevated LDL cholesterol and high blood pressure and obesity are all on the Lancet Commission's list of 14 modifiable risk factors for dementia as of 2024. In 2024, they finally added elevated LDL cholesterol. It was not there previously. And I was pleased to see that, because I think that was long overdue in recognizing your lipids as an important factor. And interestingly, when it appeared on the list, it tied for first place with hearing loss. So really keeping your LDL-C, or, ApoB, however we want to refer to it. There are different things, but essentially reflect something similar. Keeping that in good working order is incredibly important. And few things drive me more crazy than the misinformation about cholesterol health and eating saturated fat and eating dietary cholesterol. But we can get into that later if you want. Anyway, ladies, keep your LDL-C nice and low.
I know it's almost crazy how much debate there is over that fact, given the just
the
all of the
mountains
data
of evidence. Yeah, exactly. Yeah.
And one thing that I want to point out is all of the labs that you mentioned are very easily accessible labs, and they're very inexpensive.
Yeah.
And so, there are definitely places that price gouge patients on these labs, but you could get all of those labs in our clinic for less than $100.
Yeah,
easily.
exactly. And thank you for being a practitioner who an expert who who will order these labs, because unfortunately not everyone does. I do have a lot of clients in the last 5 years who they can't get ApoB, they can't get some can't even get HbA1c, only fasting glucose, which is like something I forgot to mention that is super important: Lp(a) or lipoprotein A. So this is a genetically influenced lipid that is highly atherogenic, more so than LDL-C alone. And so this is a test you really only have to have one time because it's genetically influenced. Unfortunately, that also means that diet and lifestyle don't do a lot for it. But it's good to know because there are medications in the pipeline. Hopefully next year or 2027, we'll have medications that directly target Lp(a). And secondly, what it tells you and your physician is that you are someone who needs to keep your LDL-C and ApoB nice and low. Like, for example, I have extraordinarily high Lp(a). So thanks, mom and dad. But so for me, I need to keep my LDL-C super low. And thank goodness I know that, because otherwise I wouldn't know. And I might, I wouldn't be as aggressive. So, and then you also asked about testing ApoE. I'm not sure if you want me to go into that at all.
Yeah, I would love to hear more about that. And, we do add, in recent years, I have been adding Lp(a) and ApoB to my patient's lipid profile because it gives us just a better picture. And, there are people who are on the fence about starting a statin medicine or even changing their diet. And if we have that data, we can say, I tell my patients, I'm either going to twist your arm more about this or not based on this data. And maybe we can be a little bit more liberal or less liberal, but at least knowing more data that tells us more about your personal risk can make us have a more informed conversation, informed decision about what we're doing. And like I said, they're inexpensive tests. They don't have to charge you an arm and a leg. And if somebody is charging you an arm and a leg for them, then perhaps seek a direct care provider who does negotiate lab prices for you and isn't trying to profit off those labs.
Agreed. Completely. Information is empowerment for sure. And it just helps your physician, have a much, a bigger clinical picture, which is really going to only benefit you. In terms of ApoE, so this is a gene. Everybody carries ApoE, and then there are 3 potential alleles. So 2, 3, or 4, meaning a combination of 6 different combinations of these of ApoE in you, because you inherit a copy from mom and 1 copy from mom and 1 copy from dad. So you can be a 2-2 or a 2-3 or a 3-3 or 3-4, 4-4. And so ApoE2 is considered protective, or presumed to be protective at this time, although it's very rare. ApoE3 is the most common, and then ApoE4. And 1 copy of ApoE4 confers a roughly 2 to 3 times increased risk of Alzheimer's disease compared to somebody who doesn't carry ApoE4. And then someone carrying 2 copies of ApoE4 confers around a 12 times risk compared to someone who doesn't carry ApoE4. However, the super important thing is that people who carry even 2 copies of ApoE4 are not destined to develop Alzheimer's disease. It's a risk gene, not a deterministic one. And also, people who don't carry any copies of ApoE4 can develop Alzheimer's disease. My mother is a perfect example, and there are many others. So it's one of those things where only test it if you're going to feel empowered by that information and do the things. And we can talk about what those things are. If it's only going to upset you, make you anxious, give you a sense of impending doom, don't do it. Just do all the things anyway to protect yourself. But there are some interesting things and much, much more, in the works. But there are some interesting things about ApoE4. People who carry it, we know that they want to keep their LDL cholesterol super low, like under 70. That's that is considered a risk factor for just like LP little a or type 2 diabetes. So keeping your LDL-C nice and low, getting enough omega-3s because you're not utilizing them as well as somebody who doesn't carry ApoE4. Exercise is incredibly beneficial for people with ApoE4, and ApoE4 tends to impact women more significantly than men. So especially if you're a female ApoE4 carrier, just do all the things. Don't freak out. It's not a deterministic gene, but just make sure that you're doing the things that you can to prevent the disease.
Yeah, I think what I'm hearing is do the things.
Yeah,
And
do the things anyway.
yeah, do the things, the preventative things. And if, for example, you have a close relative who's had Alzheimer's, or if you are at higher risk, or you're just curious if you are carrying that higher risk, you can get the genetic testing. It exists, it's out there, but take it with a grain of salt, because it doesn't mean that you are definitely going to get Alzheimer's. And if you don't have it, it doesn't mean that the lifestyle preventative factors aren't relevant to you. Because,
no, in fact, they're more relevant. Yeah, I would say.
Yeah, exactly. Because you can still get Alzheimer's without it, but perhaps they might be even more protective. And I think that is true for types of diabetes and things like that too. So autoimmune diseases with specific markers, the lifestyle stuff still is important, whether or not you have the biomarkers.
Yes, I think sorry to interrupt you. I just want to just really highlight that, because in the 20 years I've been practicing, I can't tell you how many times I have heard from a client, well, yes, I have high blood pressure, but it's genetic. There's nothing I can do. Yes, I have high, cholesterol. There's nothing I can do, et cetera, because it's genetic. Actually, you're someone who wants to do the things extra hard because it does matter. So I just want to encourage people, even if it's in your genetic makeup, to have, a metabolic health that's a little bit wonky, like all the more reason to get after it and control the things you can control.
And there's having high blood pressure, and then there's having a complication from having that high blood pressure. There's having a stroke, there's having kidney failure that needs dialysis, et cetera, et cetera. And so there are plenty of people who live with mild hypertension, are treated for their whole life, and they never have a complication from it. Same with diabetes. So just because you have a predisposition to something does not mean that you have to have complications from it, or the real things that we're trying to prevent. So I think yes, I do agree that knowledge is empowerment for sure when it comes to health, but it is also how we use that information, interpret that information, and who is guiding that information.
Agreed.
Because there are a lot of people ordering a lot of labs on patients or testing on patients that isn't really based on science, and they're charging a lot and sort of selling them as some sort of panacea or something you should know. And that's not always true, especially if you're not getting guidance from somebody who is a credible expert. So yes, labs and knowledge is empowering, so long as it's the right knowledge guided by the right person.
Yes, excellent point. We don't need these, several $100 a month memberships to lab work that we get twice a year in our homes, and tells us all kinds of information nobody ever needed to know. And especially, something I see, and I'm sure you see as well, if the answer to your quote abnormal blood work is a line of supplements that cost several $100s a month, that's probably not it.
Yeah, sold by the person who told you the test was necessary.
That you had adrenal fatigue and you need, yes, right.
Yes, yeah. There's this influencer strategy, which is like create hysteria around something that you have sort of made up, and then sell a supplement or product or program to treat the problem that you have created for this person.
It's a classic formula: create a problem and sell the solution.
Yes, exactly, exactly. It's great marketing,
Yeah,
but the ethics are questionable at best. um,
absolutely.
but okay, so I kind of want to talk about, what are the things that people can do?
Hmm.
One of the things that I want to talk about is there's this great movement now of like strong over skinny
Hmm.
women getting more educated about strength training and the value of muscle as we age,
Hmm.
both metabolically and for um, long-term physical health as well. I would love to kind of hear your thoughts on that and how it relates to brain protection, Alzheimer's prevention.
Sure. So this is also something super exciting to see as I just turned 55. And so when we go back, say 30, 35 years, it was, and really up until fairly recently, it was all about being as thin as possible. That was considered the standard of health. I don't ever remember strength being mentioned at all, let alone strength training. So this is a really wonderful evolution in women's health and fitness and lifestyle that I have seen, especially over the last 10 years. That's very exciting because it is just directly linked with better health, better longevity, aging well, health span, and a reduced risk of dementia, especially Alzheimer's and vascular dementias. And this is, I'm sure we'll find out more as the years go by. That's kind of how this works. But more muscle mass means better glucose regulation, so better insulin sensitivity, lower chronic inflammation, less visceral fat typically, lower risk of falls and injury, and more active typically. What it's going to mean if you're building muscle, especially as a woman in midlife, probably means you have a more active and engaged lifestyle and are focused in general more on healthy behaviors. So strength equates with better brain health today in the moment and a lower risk of neurodegenerative disease in the future in too many ways to count. It's like I think of it like an insurance policy, really. And it's hard work. I get it. I didn't start strength training until I was 50. I didn't realize it was important. And I was one of the classic examples of someone who really never just genetically and in terms of the way I was raised and just all of the factors that go into being at risk of overweight and obesity, they didn't really play in my life. And I really didn't I had 99 problems. Weight wasn't one, up until I was about 47. And then between the ages of 47 and 50, I gained 35 pounds. And even though this is what I do for a living, I was a bit at a loss. And one of my friends and colleagues said strength training is going to be like the saving grace here. You just have to get after it. It never even occurred to me, really, even though I advocated for it, to start doing it myself because I was like all about the, biking and walking on a treadmill and so on. So I started strength training, and it really was, not only did it help with improving my metabolic health and my body composition, but just a sense of confidence and how I felt inside my body. Something I've noticed is women start to say things like, I don't feel like myself. Now that can mean physically, mentally, emotionally. It can mean lots of different things. But when they say they don't feel like themselves physically, often that means a loss of muscle mass. They quite literally are different, and things fit differently. They move differently. They carry themselves differently. And so I just cannot advocate enough for strength training in that
Yeah,
regard.
and tell me a little bit more. Let's talk about that a little bit more, like the loss of muscle mass as we age.
Hmm.
And there's so much conflicting
Yeah.
data on whether, like, the loss of conflicting data and conflicting opinions
Hmm.
on whether the loss of estrogen furthers that muscle loss. I would love to kind of hear your thoughts
Hmm.
on that, I guess, controversy,
Yeah.
as well as just for our readers or our listeners for our listeners who may not be aware,
Hmm.
how does muscle change as we get older?
Yeah, so this is a really important point. And yes, a huge source of confusion. There's sort of, it seems, two camps, right? And one camp is very much talking about how, menopause or the menopause transition, perimenopause, is just this absolute destruction zone for muscle mass. When in fact, muscle mass starts its decline in our 30s. And so that has nothing to do with perimenopause, menopause, the menopause transition. It really is more about aging. So I always get super excited when I can talk to women in their 20s and early 30s because they still are sort of at peak muscle mass, even if they've never really been exercising very much, that just naturally they're at their peak muscle mass. And then what we have to do in our 30s, ideally, but certainly it's never ever too late, ladies, clearly. But if we can start combating that, like say around 35, eating enough protein and strength training and getting good quality sleep, because those are the really three major things that play into building and maintaining muscle mass. If we can start doing that in our 30s, we're really probably not going to see as much of a decline in midlife. And so my best understanding of the best research that we have is that the decline in muscle mass is much more correlated or almost entirely correlated with aging, not the menopause transition. So let's get after it as early as we possibly can, but it's never too late. And we absolutely can build adequate muscle mass in our 40s, 50s, 60s, and beyond. Does that answer the question?
Yeah, absolutely. And I also think that, there's data showing that estrogen might cause muscle loss. There's data that there's meta-analyses that show otherwise. And so I don't know that that's even the most important question, because we know that with menopause, it's aging, right?
Yeah.
Like you're going to age as you go through menopause and further. And we know that with aging, we lose muscle, regardless of whether it's, I think there are outlandish viral claims about like people losing massive amounts of muscle because of estrogen loss. That's probably overblown. Obviously, every human body is different.
Exactly.
But I think more the point is as you age, and part of aging is the menopause transition, unless you do something about it, the physiology just causes people to lose muscle as they get older.
Yes.
So strength training is vital throughout life because of that fact. And gets even more important because as you age, your risk of metabolic disease and your risk of falls, fractures, all of those things goes up.
Right.
So I think regardless of the nitpicking over the science, I think the message is still the same, and the message is probably what's most important.
I couldn't agree more. You're alluding to the fact that like, who cares? It doesn't really matter when, what the cause is. We know what the solution is. I think and that's strength training, getting enough protein, getting high quality sleep for the most part, for most of us. I think where it does matter a bit is when people are making the claim that menopause hormone therapy will correct this, and that please understand, I'm a giant fan of menopause hormone therapy in the right woman if it reduces her symptoms and helps her live a higher quality of life. However, there is a big push for menopause hormone therapy for both gaining and maintaining muscle mass, and that's not data that we have. In fact, the data that we do have shows that there's a very neutral effect. So that would be the only time I would say that the answer to the question does matter, because you don't want to be using medication for the wrong purpose. There are lots of good reasons to use menopause hormone therapy. Gaining and maintaining muscle mass is not likely one of them, as far as we know right now.
Yeah. And now I think it's great that there's so much attention on menopause and menopause hormone therapy. I think this is a win for women's health.
Agreed.
However, we still can't attribute every single symptom or every single issue to loss of estrogen. It's just, there's other conditions still exist. And if we anchor on menopause hormone therapy to fix everything, we will miss big, important diagnoses, and we will delay the diagnosis of things that we can treat when we can treat them. And so I think it's still very important to have your whole health evaluated. And I think one big red flag is if you go to a clinic and it says, we are a hormone clinic, and you call them on the phone and you ask them, what does a typical treatment plan look like? Because of course, you know, people want to know what they're going to get out of going to a clinic. And they can actually tell you, they can give you an answer of, well, we usually do this and this and this and this, without knowing anything about you. And it's their receptionist. It's not like you're not actually talking to the physician or
a clinician
person
of any
who's going to be
kind.
writing the prescriptions.
Right.
That is a huge red flag, because the treatment for every single symptom should not always be the same. Same is true for men going to T clinics. If you know any men happen to be listening to this episode, or I'm sure people have partners who might benefit from that little tidbit. If you're going to a clinic that says it's a testosterone clinic, well, you're going to get testosterone there, and whether it's right for you or not. So I think that's something that is so prevalent. Even now there's like GLP-1 clinics. It's like, yes, GLP-1s are wonderful medications. They've revolutionized metabolic health care in so many ways. I use them every day with my patients, but that doesn't mean they're right for every single person. And we have to do a thorough evaluation and assess a patient, because the last thing we need to miss is like cancer or something that could be treated sooner and more safely if we're doing a thorough evaluation.
I couldn't agree more. That is the only thing, you know, I am so thrilled that the menopause transition, women's midlife concerns are like, there's a giant spotlight on it right now. We've needed that for a long time, and it is so thrilling to see. At the same time, I worry that a lot of women are missing diagnoses that need to happen because they're blaming their hormones. And so we just have to be really careful about that clarification and distinction, I think.
Yeah, absolutely. And there are people who I've had patients come in and they're like, somebody put me on these hormones, but I don't feel any different. You don't necessarily need to be on hormones if you're not getting any benefits from them either. So I think this segues into my next topic and question that I wanted to talk about. Now, with so much light on women's midlife health, especially with menopause hormone therapy, there's a lot of anxiety. I feel like a lot of women are like, oh my gosh, is my body going to just like break down in a couple of years? Or like, how do we change this influx of information, which is good, into empowerment over anxiety?
That is such a good question. And it is really important. You know, the health anxiety, I think, happens regardless of whether you're on social media or not, or you're getting all these kind of conflicting messaging or not, because getting older can be scary. And some of us start to feel different, or, you know, health issues start to crop up. You know, in what I do when I'm working with a woman or myself who is experiencing a lot of anxiety over something is, first of all, acknowledge it. Don't dismiss it. It's real. And whether or not the issue that we're worried about, or, you know, what we're kind of fantasizing about may happen to us in the future, whether that's real or not, the feelings around it are real. So not dismissing that. And leading with high quality evidence, and the best quality evidence that we have, as opposed to a lot of conjecture that happens, particularly on social media, but in mainstream, I mean, on, you know, all the news networks, all the really popular newspapers and magazines are guilty of it too. And misinformation is allowed to thrive in an environment where health anxiety exists, because we're looking for solutions. And the problem is, first of all, it's not good information. information. And secondly, it only makes us more anxious because we've got this expert over here saying one thing and another expert over here saying something else. So number one, not dismissing it. And number two, leading with the evidence and pointing people in the right direction for the evidence, like major governing bodies that talk about scientific consensus instead of like really granular, really kind of more anecdotal information. And something I always ask my clients or anyone I'm talking to think about is, okay, the information you're receiving, is it making you feel fearful as opposed to empowered? That's, to me, probably the biggest red flag that there is. And secondly, distinguishing between something that's interesting and something that's actionable. So interesting might be emerging evidence that we have in mouse studies or something similar, as opposed to something that we actually have more documented evidence on and we can actually act on it with confidence today. But then I think finally, the most important thing, and the thing that I feel like is when I look around, and I've observed it in myself too, one of the hardest things to do is mastering the basics. So eating something green today, going to bed on time, moving your body in a way you love for at least 30 minutes a day, staying socially connected to people you love and who light you up and who don't stress you out, learning something new this week, keeping your brain engaged and treating it like a muscle. And managing your stress. I mean, finding a way. I'm a huge advocate of having a stress reduction practice that you practice daily. This is not something that you only do when you're feeling wigged out, like go to therapy or go get a massage or, something else. I'm talking about like taking a walk or breath work or meditation or listening to a song and dancing like a freak in your kitchen, whatever you have to do. One of my favorite things. Whatever you have to do to filter some of that out, literally on a daily basis, ideally bookending the day, like starting a day with something and ending the day with something, it really makes a huge, sleep, or rather stress hygiene, I think is really overlooked, like something that we really make a daily practice of. So I think it's, kind of all of those things. But I think something that women deal with a lot is just feeling dismissed and feeling like their concerns aren't being taken seriously. And that health anxiety is a real issue that honestly, if allowed to go on, can turn into something, either because stress does manifest physically 100% of the time, or we're not sleeping, or we're overeating or undereating, or we're taking a bunch of weird supplements that are going to cause liver toxicity. I mean, the list is endless in terms of what can happen when we ignore someone's anxiety. So I think that would be the first step. But then also mastering the basics. Don't worry about the exotic, until you've completely nailed sort of the pillars of your core health.
Yeah, it's like the completely unsexy stuff, right? Like
low-hanging fruit.
Go to sleep. Like sleep instead of scroll, or like I think also just like putting away your phone.
Yes.
To maintain concentration when you're trying to work or accomplish a task, or when you should be sleeping. I mean, I am not perfect about that by any means, but it makes such a huge difference.
Yeah.
Little things that don't cost a bunch of money can be super, super helpful, and usually are much more helpful than the catchy, virally things that you see online. It's just, we have this idea of like, I need to do more to get to my goals. It's often do less. The things that you don't do, like for me, like it's not having caffeine, not having alcohol in my life, like not staying up late. It's not having the phone in front of me. It's all like the things that I choose to not have in my life, right?
Yeah.
And so I think that it's so much, I think we're more programmed to like think about what more should I do? Sometimes it's what less you can do, engaging with things that aren't helpful for your mind or brain,
I couldn't agree
or your
more.
body.
When I've had clients who are very clearly kind of just over consuming bright, shiny objects everywhere. Got to have it, got to do it. It's going to be the next thing. It's going to be the thing, right? That just completely turns my life around. When I have had clients who have that predisposition in the past, one of my kind of parts of what we do together is a 6-month challenge. Buy nothing. Don't buy another supplement. Don't buy another gadget. Don't take a new class. Don't do anything new for 6 months other than go to bed on time, eat, like structuring their diet to include more fruits and vegetables, let's say. Find a stress relief practice that costs nothing. Like, in other words, don't spend money and try to ignore this bright, shiny objects and just do the core basics that don't cost a thing. I mean, obviously food costs money, but other than that, and it's and just see how you feel at the end of 6 months of not investing in the next thing, but rather kind of turning inward a little bit and looking at what do I already have that I can work with that costs me nothing, that is actually probably so much more foundational and so much more helpful than, the next sleep gadget or wearable or whatever, something in a bottle.
Oh, I love that. I'm gonna adopt that for myself.
It's pretty effective. It's hard because you start to realize, oh my goodness, I am literally like clicking on every
Yeah.
And it just, you got to have a little mantra too, like something that reminds you of why you're not doing that thing. But yeah, it's really can be transformative.
Yeah, no, I love that. I think it's so normal to be the opposite of that.
Yeah.
And so we almost feel like, we're always sending each other, oh, you should buy this new thing, or this was so helpful. Like, and some of it is, but I think
it'll still be there in 6 months if you want to. Do you know what I'm saying?
Yeah, exactly. And there's nothing that we really need that bad, most of us.
Mm-hmm.
So, no, I really do love that. Well, I have loved this conversation.
Me too.
I was wondering, is there anything that I haven't asked you about or that we haven't gone over that you would like to share with our listeners or that you feel like they should know?
Gosh, I don't think so. I think I think your questions have been great. I hopefully your listeners will have like even just one really key takeaway that's gonna that they can start today and be consistent about, even for, just like try one new thing that you heard about in this podcast for 30 days and see if you feel different, see if you feel more encouraged to go on and move on and do more. But I think it would just be that. Start slow. Don't feel like you have to do all of the things overnight. If you just did one new thing a month for the next 12 months, a year from now, you will have made 12 huge, probably very huge changes that will make a giant difference in your brain power today and the risk of dementia in the future. And that's my goal for everybody listening.
Yeah. So I think some of the things that we talked about were start now.
Mm-hmm.
Midlife is a window of opportunity
Absolutely.
to focus on yourself and perhaps the things that you can shy away from instead of trying to go after might be the key that unlocks your ability and headspace to really serve your body and your mind for long-term cognitive and really whole health.
Yes.
But they do marry, like they go hand in hand. The body is a system. We're not just like a brain by itself or a heart by itself. And luckily, the things that serve each organ usually serve all organs.
Right.
Trying to engage with healthy habits now, whatever age you are, is the right time.
Absolutely. And I think my philosophy for the last, I don't know, I guess decade has just been when you're focused on, we tend to focus on our body parts, especially when we see them changing in ways that we don't like. But I have found that if you're focused on the health of your brain, you really are focused on everything else by default. and everything else can kind of fall into line if what you're doing on a daily basis is to the benefit of your brain. And rather than, because I think this is certainly not unique to women, but certainly common among women, rather than feeling like you need to fix yourself or fix something about yourself, think about building yourself in a way that is going to be really thriving at 70, 80, hopefully 90, instead of the trajectory that we're kind of on, which isn't as beautiful as I'd like for it to be, but we can change that. That's what we're doing.
Yeah. Yeah. And living with intention and alignment, is not all about just your physical health. It's about your mental health and what you do with your time and your energy and your thoughts and all of those things.
Right.
And if you are listening to this and you're like, gosh, there were so many good ideas, where do I start? I'm going to say start with sleep.
Yes.
Fix your sleep first. It's the foundation to everything. So Barbie, so wonderful having you on, and I'm so happy that we got to spend some time together.
Me too.
Where can everyone find you if they're looking for you? I know you have some wonderful platforms.
Oh, thanks. So probably easiest is if you're on Instagram, is the Cognition Dietitian on Instagram. I'm also on Substack. I have a newsletter that goes out between 4 and 8 times a month. And I'll be expanding that platform in January. And that's the Synapse on Substack, and also under the Cognition Dietitian. And then my website, barbieboules.com.
Thanks so much. Go check her out. I follow her on all the platforms. And if you are interested in being our patient, you can find us at our website at sacomplete.com. Learn more about what we do on my Instagram, just my name, Dr. Arti Thangudu, and please subscribe to this podcast, Endocrine Matters. Thanks so much for listening.